Greetings again to everyone. This is again Doc Cherry, Doctor of Physical Therapy. Some of you had been asking about osteoarthritis of the lower back area. Some of you have asked about bone spurs and what can be done. In this video, you will learn about osteoarthritis of the lower back area, or otherwise termed as lumbar spondylosis. And stay with me until the end for you to know about the 3 home exercises and the positions that you need to avoid if you want to manage lumbar spondylosis long term. Just like all the other joints in your body, such as your hip and your knee, your spine can also become arthritic over time. When osteoarthritis affects your lower back area, we call that as lumbar spondylosis. You might be wondering why this happens. The arthritic change in the spine actually begins in your facet joints. This happens when the facet joints, the one that allows motion in your spine, loses its cartilage, resulting to bones rubbing with each other. Another arthritic change can also be attributed to your intervertebral disc. Over time, or as we age, our intervertebral disc actually loses its water content, leading to dehydration of our bones and leading to its over time collapse. This forces your bones to move closer together, giving more pressure to your facet joints, and this will eventually result to bone overgrowth, or what we call as bone spurs. If not corrected, this can lead to stenosis, or the decrease in the diameter of your spinal canal, which can lead to the impingement of your nerve or your spinal cord. This degenerative change in the back is actually linked with aging and genetics. It is common to people more than 40 years old, and it is usually more common to people who have a family history of osteoarthritis. So persons who have parents or siblings who have osteoarthritis are more likely also to develop the symptoms. The symptoms of lumbar spondylosis can vary person to person, but the most common symptom, of course, is low back pain. You can notice stiffness or difficulty sometimes in different ranges of movement with your spine or when you move your trunk. And some patients, if it is left untreated, as I have mentioned earlier, it may cause nerve compression or nerve impingement, such as the case of sciatica, where you feel numbness and pins and needle sensation in the back part of your buttocks, in your back part of your knee, and in your lower leg. If you are 40 years old, if you have a family history of osteoarthritis, and if you have recurring back pain, it is best to have yourself checked. The diagnosis of lumbar spondylosis or osteoarthritis of the lower back is based on your physical exam. It is based on your symptoms and the result of your x-ray. An x-ray would be helpful to check if there is degenerative changes in your bone and the presence of bone spurs. And sometimes MRI is useful to check your intervertebral disc and the status of your nerve. But don't worry, an x-ray is enough to make a diagnosis of lumbar spondylosis. It is affordable and the result would come in more quickly. Before we proceed to our 3 home exercise and the position that you need to avoid, I would really appreciate it if you can take only 1 second of your time to please click the like button below as your way to support this channel. Now you might be asking what can be done. I usually take time in educating my patients on the positions that they need to promote and positions that they should avoid. This is the only way to manage osteoarthritis conservatively and long term. With lumbar spondylosis, you need to remember and you need to understand that any motion that puts your trunk into extension, such as when you lurch backwards, it will always exacerbate your symptoms, so avoid it. Your position of comfort or the position that will relieve your pain is putting your spine into flexion. That's why home exercise programs should be patterned with this concept that it will promote spinal flexion. Lie flat on a bed or a floor without any pillow and bring one leg to your chest. Hold it for 7 seconds while the other leg remains flat on the floor. Slowly bring it down and repeat 10 times. Do it as well on your opposite leg. For your second exercise, you bring both knees together to your chest and hold it for 7 seconds. Slowly bring both knees down and repeat this one 10 times as well. For your last exercise, you can use a simple blanket that would be long enough for this. Roll it and put it under your feet while holding its end. Then gently pull it up like shown to a range that is comfortable for you. This will feel good. Hold it for 7 seconds and slowly bring it down. Repeat 10 times and do it on your opposite leg as well. Do these exercises 4 to 5 times a week and do this consistently. This is our long-term protocol to help manage osteoarthritis long-term and prevent surgery. Thank you very much for watching. I hope that this video have helped you understand lumbar spondylosis or osteoarthritis in the lower back area better. Should you have any questions about osteoarthritis of the spine, please comment down below because I would really get back on you. Please check this video to avoid all the motions that are actually causing harm to your body that you are not aware of. Please share this video to your friends and family members so we are able to reach out to more people. This is again Doc Cherry. Stay safe, stay happy and healthy. God bless you.